Well, good evening, good morning to all of you. I'm Matt Austin. I'm a faculty member here at Johns Hopkins University, and I'm going to serve as the MC for today's virtual open house. And we're really pleased to have all of you who are potential students in the program to join us today to hear more about the program. We're very lucky to have an esteemed panel of current students and alums who are willing to come share their experiences, what they've liked about the program, how they got interested in the program, what challenges they've encountered. So we're willing to share whatever information we can share with you to help you make a good decision about whether this is the right program for you, which I'm sure it is. So I'm going to go ahead and start with some introductions. I'm going to introduce myself. I have some colleagues from the program who are here with us tonight, so I'm going to ask them to quickly introduce themselves, and then we'll get to introductions of our esteemed panelists. So as I mentioned, I'm Matt Austin. I'm an associate professor here at Johns Hopkins in the School of Medicine with a joint appointment in the School of Public Health. I serve as a co-director of the online program of applied learning for the Masters of Applied Science in Patient Safety and Healthcare Quality. I also teach a course in the program as well. So I will be one of the instructors that you will encounter as part of your time in the program. I am joined tonight by the director of the program, Dr. Albert Wu. So Albert, would you like to introduce yourself?
Oh, I was just writing a note to Naruti Sai saying that she's not more casual than me. Today I'm modeling a denim work shirt and a quilted vest. But otherwise I'm, oh, there you go. Okay, you see, I fleshed her out. I'm Albert Wu. I am an internist and professor of health policy and management and medicine, and among other things, director of the program. And one of my main research interests at the moment is how to support and keep healthcare workers safe in addition to patients.
Wonderful. Thanks, Albert. And Dr. Paula Kent, who's one of the co-directors of the program as well, and one of the course faculty as well.
Hi, I'm Paula. I am a nurse by background, but I did complete my doctoral work at Bloomberg School of Public Health, and I am now currently teaching at both the Johns Hopkins School of Nursing at the School of Public Health, and I'm a co-advisor with Dr. Austin and others for the OPAL program. So I'm really happy to help support our panel discussion tonight, and glad that you're all here.
Great. Thanks so much, Paula. It's been a real pleasure to get to know and to work with Albert and Paula over the last 5 to 6 years. It's been one of the great joys of my time here at Hopkins. So that's wonderful. I'm going to introduce our esteemed panelists next, or actually I'm going to ask them to introduce themselves. And so with that, I'm going to actually ask Dr. Melissa Klinsman to go first with the wonderful backlighting to share a little bit about herself.
Hi, everyone. I'm Melissa Klitzman, and hopefully this backlighting will go down as the sun sets. But I am in my last term in this program, and I am an assistant professor of clinical pediatrics here at Indiana University School of Medicine. So I am in Indianapolis, Indiana, deep in the Midwest. And in my clinical capacity, I am a pediatric hospitalist within the division of neonatal perinatal medicine here. So I take care of patients that are kind of our feeder grower patients. So those patients and families who have gone over kind of the acute illness phase of the newborn intensive care unit and are now kind of convalescing and making that critical transition to discharge home. So I really love my job. I tell people all the time, I cuddle babies all day. And I really love empowering families to take on a very complex medical system and advocating for the health of their baby as they leave our care.
Wonderful. Thanks so much, Melissa. It's great to have you here with us tonight. Frank, would you like to go next, please?
Yes, thank you, Matt. Hi, everyone. My name is Frank Kahn. I'm an alum of the program, graduated in 2021. I've been in the patient safety space for about 10 years, worked for 4 different health systems, and I'm currently working for Providence Health in charge of implementing high reliability and patient safety across the Northern California region. My focus has been primarily on teaching and engagement for the caregiver and clinical and leadership staff. So I'm excited to be talking today and sharing part of my journey with the program.
Wonderful. Thanks, Frank. And Emily, would you like to go next, please?
Sure. Hi, everyone. I'm Emily Weisberg, and I am also in my last term right now. We have a paper due tonight, so I can't give you all of my time, unfortunately, but happy to answer any questions. I live in Chicago and work at Lurie Children's Hospital downtown in the city, and I'm a patient safety and quality healthcare improvement consultant. So we are dispatched throughout the hospital. It could be any department to improve our systems overall. And I focus primarily on patient safety. So any adverse events that happen, we go in and take a look at what happened, why it happened, how we can prevent it from happening, and then how we measure that we can prevent it from happening. So really happy to be here and look forward to hearing from all of you.
Wonderful. Thanks so much, Emily. So the way we want to sort of structure this is actually for it to be fairly informal. I do have some questions prepared to ask our panelists, but we're really here to make sure that those of you who are considering this program walk away with the information you need to make a good decision.
Matt, let's let them introduce themselves. We're a small group.
Okay. Sounds good. So Marjorie, do you want to?
Yeah, sure.
Do it again.
I, as I said earlier, I'm from Melbourne, Victoria, in Australia. It's 8:41 in the morning, in contrast to the evening and afternoons with everyone else. I'm actually a infectious diseases physician. I do a bit of general medicine, and I also do infection prevention or infection control. So I am currently the head of infection prevention and infectious diseases at my organization, which is a healthcare service in Victoria. And I am interested in, I've always been interested in patient safety and quality. I once had the pleasure of listening to Dr. Provenos speak, and I was a young, impressionable resident registrar at that time, and that really sparked my interest in this area. And being an infectious diseases physician and working in infection control, it naturally leads into this area of patient safety and quality anyway. So I'm here to try to find out a little bit more about this program, trying to see if living on the other side of the world can fit into the program, and how it will mess up my sleep-wake cycle to try to pursue this. And if I am actually able to find the time to fit this in the midst of everything else, you know, is a lot less crazy compared to 2 years ago, where everything I was doing was COVID. So I am looking at doing something different now.
Wonderful. Well, we're happy to connect you with current students who are from Australia, alums who are from Australia, who can definitely speak to how much the program impacts their sleep and wake cycles. My guess is it's not very much. I would say 98% of the program is actually asynchronous. So lectures are recorded, assignments are done when you can do them. Obviously, they have due dates, but all that can be done sort of in your own way and in your own time. There are periodic sessions that we call live talks, which are live. They tend to be in the evening here in the United States, on the Eastern time zone in the United States. So it works out to be pretty good in terms of early morning there in Australia. So hopefully that wouldn't force you to get out of bed too early. So, but that's just sort of the structure, right? So I think you should be in good shape there. Mary,
Thank you.
Mary, would you feel comfortable introducing yourself?
Yeah, of course. I'm Mary Vogt. I'm from South Central Pennsylvania in the United States. I have experience as a registered respiratory therapist, and a lot of what we do is also infection prevention of VAP events. We do a lot of obviously trying to control whether or not patients are going to get worse. I see a lot of things in my job that focus around this area. I see a lot of, unplanned extubations and things like that we're always trying to prevent, and how that affects quality of care and basically like patient trajectory in terms of their illness. I've also done some research in the area of pulmonary fibrosis and interstitial lung disease, and a lot of focus of that was also, I did some research in COVID, worked actually on the ACT trial to get remdesivir and baricitinib approved and stuff like that. So I've done a wide variety of things, but I really think this is a very, very important area of medicine that's not focused on nearly enough in hospitals.
Yeah, wonderful. And we've had other respiratory therapists go through the program, and I think have done really well and have found it to be a valuable experience. So thanks so much for sharing. I'm going to probably mispronounce your name, so my apologies in advance. Naritsai? Did I get somewhat close?
That's an excellent attempt. It's close. It's Narutsai, but I was going to offer that you can call me Nancy, as almost everyone else does. I just am not tech savvy enough to know how to change that on my computer screen. So I am retired from my medical practice for my own personal health reasons, but I've always been involved with teaching. I was actually at Hopkins over 15 some years ago, teaching resident staff. And it's nice to look into something more formal for education. I'm currently teaching local colleges, and I'm volunteer consulting. We've all lived through COVID, and it's just for me a curiosity. Stepping back to becoming a student again, I'm kind of concerned about teaching the sciences. It's either a yes or a no, and anatomy hasn't changed. Some physiology and stuff has changed, but just for me, with regards to what the expectations are as a student with regards to writing, it's reassuring that the most of the classes are asynchronous. I am on the East Coast, so time zone's not a big issue. I'm an hour north of Philadelphia in the lovely town of Reading. And so, same timeline as Baltimore. But again, I'm just a little nervous stepping back into the student role, being very comfortable in the teacher role. So I'd love to hear from other students what they find the expectations are.
Yeah, okay, wonderful. I'll take a special note down on that. We'll make sure we get opinions on that. I think what I will share with you, if this helps, is most students can complete the program in anywhere between 2 years and 4 years. If a student completes it in 2 years, they take 2 courses each term. If they choose to complete it over a 4-year span, they take 1 course at a time. So it can really sort of be paced at what matches up with your life in terms of work, family, other commitments, other interests that you might have. So I think there's ways to sort of tailor it so that you can even sort of gradually work your way in and ramp up if you feel like things are going well. So, but we'll definitely ask our panelists about how they've sort of felt coming back to school and being a student again. David, would you feel comfortable introducing yourself?
Oh, David, you're on, we can't hear you.
Okay, we'll come back to David. Sam, if you're comfortable coming on camera, that would be wonderful. If you're not, that's fine too. If you'd feel comfortable introducing yourself, that would be great. We'd love to hear more about you.
I know you were driving, Sam, so I don't want to cause any mishaps.
Yeah. Okay. And then there's someone calling in from an 816 area code number. Is that anyone who wants to identify themselves or introduce themselves?
Hello.
Hi. Good evening.
Yeah, hi. Good evening. My name is Miguel Uzumere. I'm actually in Texas. Well, I have an 816 number. I put that down.
Well, good evening from Texas.
Yes. So I have a different time zone. So that was also almost a problem for me catching up on this meeting. My background is I am a registered nurse. I have a background in intensive care units, but lately I've been doing more of home care, and my interest in this program stems from everything that's happened with COVID and just how much we really don't put enough into the things that come with safety of the patients and everything else around them. I haven't been in school for a while, so I don't know. We'll see.
Yeah, well, as I mentioned, we have had folks from all different backgrounds go through the program successfully. We've tried to tailor it in a way that students can sort of go at the pace that they feel like is right for them. And I think the sort of common denominator that we've heard from students is, as long as you're willing to reach out to folks when you're having troubles or struggles, whether you reach out to the faculty or the TAs, they'll make sure that you are successful in completing the program. So I think that's been the common theme that we've heard over and over again. If you reach out for help, you'll get it and you'll be successful. All right, David, do you want to introduce yourself now? Thanks for your patience.
Sorry, I forgot that my computer has no audio. So when I jump on these Zoom meetings on my desktop, no one can hear me. I apologize. My name is David McLean. I am a associate professor at the University of Florida in Gainesville, Florida. I am in the Department of OBGYN, specifically a maternal fetal medicine subspecialist. And I've been in the patient safety quality space for about maybe 15 to 20 years now. And I've sort of interested in this program because it offers, sort of certification in terms of having some expertise in this. I am sort of at the end of my clinical career, but love still working and being involved in the teaching and sort of space. So whether it be teaching postgraduate students or other clinicians, basically about the importance of this sort of area of clinical medicine that I think a lot of people try not they to try, but really don't have the bandwidth to pay attention to. So it's one of the primary reasons why I sort of feel that there's a big need for clinicians to be advocates for how we can integrate this aspect of clinical care into all the other things that we do.
Wonderful.
So David, I was actually on the scientific board for your ICTR with David Nelson and Liz Schenkman and other folks. So
Oh, wow.
I know you guys well.
Yes, great.
Yeah, it'd be great to. So we've had a couple of questions identified. I did prepare some questions for the panel, but I think I might deviate from that to make sure that we get questions answered that potential students have raised. So if folks are comfortable with that, and Melissa, I might punt the first one to you and then follow up with Emily and Frank, which was, what was your experience in becoming a student again? I'm sort of, I guess, guessing there was maybe a gap between your schooling experiences, but maybe I'm incorrect.
Yes. There's a pretty lengthy gap. I'm not going to go into it because I would date myself, but I actually enjoyed being a student again. So, I'm an attending physician in a NICU, and, part of my job that I enjoy is to teach residents and students and RT students and nursing students that come through. But I feel like I always have to have the answer to their questions. And I really liked being a student again, not knowing anything and not knowing that I have to find the answer and study, but being able just to ask a lot of questions that I don't get to ask as much as an attending. So it was actually a real nice reprieve for me to be a student. And then also, I structured my study time so that sometimes I would like front load it for a term, if I knew I was going to be like on service for a couple of weeks. So I do a lot of studying in advance. And then I'd always kind of make just like a steady schedule. And that really helped me not fall behind. And there's some times where it's like, I got to get up and study, and it seems like a drag. But once I started with the material, it was just so interesting that it was just engaging. So it's more just like starting to study again and read and learn. And like a lot of you are saying, healthcare quality and patient safety is not something that's ingrained in kind of medical care, whether you're coming from respiratory therapist or nursing or a medical student. So it is really something that is not novel, but it's something that is, at least for me, something I needed to catch up on to give me another dimension of how to practice medicine.
Thanks, Melissa. Frank, would you be willing to share your experiences?
Just to echo some of the points already stated, I mean, time management was a huge thing that I had to develop because I have two small kids, and I started right around when COVID came, and so we had homeschooling and work and balancing school. And so what I did was I would study early in the morning when the kids were still sleeping during my lunchtime, and then maybe when they went to bed on some weeknights. So that's how I was able to kind of manage it all. But I loved coming back to school. I loved being part of the Hopkins community in particular. And I felt like the program made me better at my job because I was already in the patient safety space because I was working and learning all these things at the same time. But then in turn, also, I think my job made me a better student as well, because I was able to apply everything that I was doing in my job to my work in the program. So it was a really great experience.
Wonderful. Nancy, not to sort of pick on you, but you're the one who sort of raised this question. Does that give you a sense of what people's experiences have been, or do you have any sort of follow-ups on? Okay, wonderful. Marjorie had a question in the chat about how can students engage with others if most of the sessions are asynchronous, and Emily provided a response in the chat. But Emily, do you want to maybe just talk a little bit about what that is for folks who maybe aren't going to be able to view the chat in a recording sort of setting? Yeah.
Absolutely, no problem. you have a lot of opportunities to make your experience with other students exactly what you want it to be. Yeah, I think at bare minimum, you'll have opportunities to interact with people on the virtual discussion board as you're typing responses or they're providing responses, and it's interactive and that you can reply or they can reply to you or to ask more questions. You'll also have a couple of group assignments to work on that will also allow you to interact with some colleagues and peers. And then you also have access a lot of the time to different people's emails, and people are very flexible and willing to have you contact them or contact you. I will also say I in particular wasn't worried about having connections during the program, and actually did find it really easy and great to have those connections. So I have one peer who actually lives in the same city as I do, and we've met up like once or twice in person just for the heck of it because we could, and constantly text about our coursework. So that's been a good connection. And you can participate as much or somewhat as little as you want as well, depending on your time constraints.
Yeah, and Frank, do you want to chime in on this one too? I feel like this was important to you, I know, as your advisor. We talked a lot about this, so.
Yeah, absolutely. Thank you, Matt. I was just gonna say that there are other resources too. We have a LinkedIn group specifically for this community where you can connect with other folks currently in the program or alumni, but we also have the One Hop program, which I was an active participant throughout the program and connected with alumni beyond this program, and which is important because you have to think just what's going to happen after you graduate, and establishing that network while you're in the program has really been beneficial for me after having graduated in 2021. I'm still in contact with a lot of folks that I connected through LinkedIn and through the One Hop resource. And it's a really valuable thing to do to kind of network and establish your network while you're in the program and beyond.
Wonderful. Melissa, I have another question for you, unless do you want to chime in on this one? Yeah,
I think the only thing I was going to add in is there are people that are really willing and available to form study groups. And so for a few courses, that's something that I utilized a lot. And that was a nice way to connect with other class members, sometimes on a bi-weekly basis, depending on the course.
And what I've often heard, Melissa, is it seems like epi and biostats is where folks find the group learning to be helpful.
Yeah, it's extremely helpful. Those are great courses, but it's extremely helpful to have a study group for those courses.
Yeah, wonderful. Okay. The question I was going to have for you, Melissa, was a follow-up about how much time per week do you spend on your coursework?
So I think, like Frank was saying, I started the degree program August, September of 2020. So in the midst of COVID. So initially I thought I was going to do the degree program over 2 years, but I wound up doing it over 3 just because of family circumstances and homeschooling and all of that. So if I was taking sometimes I would take a 2 course load in a term. Sometimes I take 4, sometimes I take 3, sometimes I take 6. So if I am taking a full course load in a term, so 6 hours, then on average, I think I spend about 15 to 20 hours. So I don't know if I'm kind of the typical in doing that. I would spend probably 1 hour if I'm, not in the hospital, a couple hours each day studying, and then some time on the weekend as well. It got to be a little bit heavier if they're towards the end of a term, if there's a paper due or something like that. And then again, it's on average because, sometimes I would do more if I knew that I was going to have less time the following week so that I wouldn't fall behind. And then again, if I was taking on a term where it's just a 2-hour course load over 4, then it would be less time. It could be, depending on 5 5 to 10 hours, something like that.
Yeah, that's helpful. And it looks like I'm just reading the chat. It looks like Frank estimated about 15 hours. Emily estimated 5 to 15, depending on the course and what she was taking. So hopefully that gives folks sort of an idea of an idea of sort of the effort that will be needed. And Marjorie had to drop off. It does look like we have a couple of folks who've joined us since we got going, and I want to welcome them and give them the opportunity to introduce themselves if they're comfortable. So Elizabeth, are you in a place where you're able to introduce yourself?
Hi, I'm actually a surgical fellow in London, Ontario, Canada.
Wonderful. We're really glad to have you. And it looks like Ben has also joined us. Ben, are you comfortable introducing yourself?
Hi guys. My name is Ben. I'm a nurse anesthetist from Ghana.
Wonderful. Good evening. Oh, no, it might actually be morning there.
It's actually 11 p.m.
11 p.m. Okay, so 4 hours right now. We've had I think we've had other past students from Ghana as well. We definitely have had other students from other African countries as well participate in the program. So we're really glad to have you with us this evening. So there's a question that came in that we'd love to hear our panelists input on, which is, how did you deal with difficult courses? And did you feel supported? And so I might go with Emily first on that.
I would say definitely difficult courses, some more than others. Thank goodness, not usually more than one of the two at a time. So you could usually dedicate a little bit more time to one when the other was a little bit more intense. And like we kind of said before, really easy to reach out to people when you needed more support. I've reached out to TAs in the past. I've reached out to classmates in the past. And it seems like most people were able to find the support that they needed during those difficult classes.
And who did that support come from, Emily, in your experience?
Colleagues, like peers or TAs, and frequently just having the extra resources and materials was helpful as well, because there's always optional readings that are offered. And sometimes that can help clarify the material further.
Wonderful. Melissa, what's been your experience?
So I would say the study groups were really helpful, for sure, for difficult courses. And then kind of for the same courses that we talked about before, the TAs are readily available and had kind of just like ongoing office hours that I would drop in frequently. Like even if I didn't have a question about the material, I would listen to other people and just get more knowledge for those courses. And then, I think reaching out to faculty is very easy as well. So I, oftentimes for a few courses would engage faculty just to get clarification on an assignment or a concept. And often faculty had hours as well. And if not, like for my last course, I reached out to Dr. Shu, and she was just, gave me a Zoom link and said, meet me at this time. And it was really easy to engage with faculty as well with questions. And I think that's a huge asset, because I think a great thing for me is the asynchronous learning of this program, but then also the ability to reach out to somebody and have a response and get questions answered or clarifications is really easy for that learning.
Wonderful. Thanks, Melissa. Frank, would you be willing to talk a little bit about how the courses are structured? Because I'm not sure we have really talked about that. So can you sort of talk about like the structure of courses in terms of lectures, assignments, projects, and what's been your experience with those?
Yeah, I personally felt that the program was really laid out very well. The professors did a really good job of sending itineraries ahead of time, so there's really no guesswork. You know exactly what's coming, what's due, expectations in terms of when quizzes are or exams or when papers are due. So I found that to be really easy to follow. Whenever I had some challenges if I didn't understand something, like what some of the other panelists said, I would just reach out to the professors and TAs to ask them questions. But the program is just really so well designed and laid out really well that it's really just kind of like a plug and play experience. At least it was for me. Yeah, I didn't really find it difficult at all to follow the structure.
Wonderful. Yeah, so I think just to sort of add on to that a little bit, so the lectures are pre-recorded. So just to clarify that for folks, that those are available, pretty much at the start of each term, so you can watch those at sort of your own pace and your own leisure. Most courses are structured in that you'll have some assignments that are due, you might have a quiz or two, and there's likely to be some sort of project. Hopkins School of Public Health is set up in 8-week terms. So each course is 8 weeks long, which has the advantage of going quickly. So if you don't like the topic, you'll get through that pretty quickly. It has the disadvantage of, things do go quickly. So you really do have to sort of keep on top of things. But I think students have found sort of good strategies for working through that. All right, there was another question in the chat from David, which asked about which courses required the most work. And then I think maybe we can talk a little bit about how the program's structured in terms of distributing those. So I might go to Emily to talk about maybe I'll have you pick one course that you thought was the most work.
Well, I had an answer until you said that. You're limiting me to one.
Okay. Or what are the two?
I would say biostatistics and epidemiology epidemiology 1 was probably harder for me just because I wasn't familiar with it. So I think those two required the more work. But I also wanted to just say to David's question that I feel like they like slowly build. So your first courses that you'll take are a lot more introductory and provide a framework for understanding. So as you learn more about the details and more like the math that's involved, it makes a lot more sense. So that's really helpful, and that overall structure is helpful. So, and then within each course, you have grade structure that's, a couple of lectures and then a quiz, or a couple of lectures and then a paper, and it's easy to follow.
Yeah, Melissa, do you have any different thoughts on tough courses in the program?
I think those are the ones that were kind of the most time intensive. I agree. I'm in the middle of the integrated activity now, so I may revisit that. But I think I agree with Emily. Those are kind of the ones that are most time intensive, but totally doable, definitely doable, just with planning and reaching out.
Yeah, and so David had a question in the chat about whether the program is structured so that, you can sort of spread out those harder courses. And I think the way we have it structured is that you're really only taking one of those harder courses at a time. The harder course is paired with an easier course. So it shouldn't be too much overload at one moment for students. So one of the things that we haven't really touched on is, what have you really liked about the program? Frank, would you be willing to take that question?
Yeah, there are a number of things that I particularly liked. One was just the focus on public health, just being in the acute care environments, just and working in that environment, just everything was just so hospital focused. And then just taking, being a part of the program just really expanded the way I thought about patient safety and healthcare quality and its impacts just beyond the hospital settings. And I really enjoyed the networking aspect of it. Just learning and meeting students from all over the world. It was just really inspiring to like learn from them. And I'm not a clinician, I'm not a nurse or anything like that. So to connect with clinical colleagues all over the globe was really inspiring for me, and continues to inspire me. So those are the things I enjoyed the most.
Wonderful. Thanks, Frank. Melissa, do you have any immediate thoughts to that question of what you've liked about the program as you come to a conclusion here with us?
I agree with Frank. I knew that the program was in the School of Public Health, but when I started, I didn't know exactly what that meant. But having now like a background in biostats and epidemiology and study design, I think makes me a better clinician and a researcher, especially kind of for future career goals. The other thing I really enjoyed about the program is that, and I think Frank alluded to this earlier, is that things I was learning in the courses, so whether it's a concept or a tool or whatever, I could immediately use in my day-to-day life. Like once I learned how to do like adjusted odds ratios, I broke out an article and started practicing. It was pretty cool to use all of these tools in my own unit and hospital, and to make a difference for my patients. So it's kind of just real-time learning that solidifies everything that all the knowledge that I've gained.
Yeah, that's really neat that you've gotten to apply that right away. If our future colleagues have any specific questions that they want to ask, we would urge you to put those into the chat. If you want to raise your hand, we'd be happy to call on you as well if you have a question. If you just want to blurt out a question, we would love to have that as well. While you think of those, I'm actually going to ask Emily a follow-up question, which is, I think one of the things that people often sort of think about when they enter graduate programs is, how am I going to use this degree? So can you talk a little bit about how you foresee yourself leveraging this degree in your career, or maybe even your personal life, if applicable?
Yeah, absolutely. Like Melissa was just beginning to say, I completely agree. I was very pleasantly surprised at how quickly I was able to use everything that I was learning in my everyday life. So the expertise that's at your fingertips when you're in this program is substantial and tremendously helpful in walking you through not only the content, but how the content has been applied in a variety of different care settings with a variety of different care team members in a variety of ways. And then you can kind of pick and choose exactly how to apply it. So for me in particular, I went from listening to lecture one day to incorporating a barriers assessment tool the next day into my root cause analysis that I was doing at work. So literally one day learning, the next day applying it into my work. And I think that's the other benefit of being at an institution like Hopkins, separate from the institution that I am at on my day-to-day work, because the frameworks are different, the structures are different, the people involved are different, but it's a great institution, obviously, that there are lots of lessons learned that can be applied in your own environment.
Wonderful. Frank, how about you? What do you see as, how have you been able to leverage your degree into bigger and better things?
Yeah, so since I've graduated from this program, I've actually changed jobs twice. Both have been promotions. I landed my first international speaking opportunity, and I've actually been asked to potentially consider partnering for an outside consulting firm. So just the opportunities keep coming, if you will. But for me, my long-term goal is to be like a international speaker for patient safety and healthcare quality. And so, and I leverage the background and the learnings that I've had to create like these engagement videos for staff and for physicians. And so I'm going to continue on that path and just accept the opportunities as they come.
Yeah, that's wonderful, Frank. And I have to give a testament to Frank's videos. He does a fantastic job. They're so well done. He really could be like the spokesman for patient safety. So yeah, I'm really tickled for you that things have turned out so well for you.
Thank you.
Wonderful. I do want to give some time just for sort of silence too. But there was a question that came in, I think from David, about whether students and Frank as an alum would be willing to talk a little bit about, I guess, their integrative activity projects, what those are, and what support you've gotten. So maybe just to provide a little context first, in the last term of the program, students take a 4-credit course called the integrative activity. And the idea behind this is it's really a culmination of all of the knowledge that you've gained in all of your prior courses. And students are asked to identify a quality or safety problem in a healthcare setting, and identify appropriate interventions to tackle that quality or safety problem, and have to create a paper around that, as well as do a very, very short presentation. So Melissa, do you feel comfortable talking about your integrative activity project? I know you're maybe still in the process of fleshing that out a little bit, but
it's in development. But my integrative project it's a long title, but I'm just going to paraphrase. It's implementing a patient navigator program, so kind of like a healthcare coach program in our NICU to address social determinants of health, with the outcome of increasing the use of any human milk in our Black infants. And this is, for me, I've done kind of work in the past in terms of breastfeeding and use of breast milk in the NICU. So really kind of focusing on health equity, quality improvement in my project. And so it will involve kind of implementing a standardized referral process to our patient navigator program in our health system, and then education around it as well to look at that outcome. So I'm very excited.
wonderful. And do you feel like you have the support you need to take that on?
Yes, yeah, for sure. I, like Emily, I'm finishing up my part 1 paper soon, in the next hour or two, and submitting that. And then Dr. Austin, I sent you an email to go over measures. So we'll touch base about that. But then I think it's great because, you know, when I first, before this degree program, I really hadn't thought about study design and like how to evaluate implementation. And so it's really kind of taking, you know, my project to the next level into adoption of the interventions that I'm proposing, and sustainment as well to improve healthcare outcomes. So I'm really excited, and I feel like I have all the tools I need. It's just a matter of organizing it and reaching out when I have help, but I know the help is there. And so I'm very sure that it will be successful. I'm very excited.
Yeah, and I look forward to connecting with you later this week, Melissa, to learn more about your project. Emily, would you be willing to talk a little bit about your integrative activity project?
Yeah, absolutely. And I was also going to say too, Matt, there was one other thought I had about how this program is impacting my day-to-day career. And I was going to say that it's also, while I am by no means a biostatistician now because of Hopkins, I understand it so much more that I'm like speaking actually the same language when I'm working with our biostatisticians at the hospital. So that shared language is also really beneficial in many aspects, not just biostats. And then my project, I am working on one of our acute care floors. We've been having a fair number of safety events related to communication factors, specifically between our resident teams and our nursing staff. And so we're implementing a couple of interventions simultaneously in a bundle to help with that. And so we're going to be using the daily goals checklist that I only know exists because of Hopkins. And we also are hardwiring some of the SBAR language into our nurses text messaging system so that they get in the habit of using the best practice communication methods to highlight closed loop communication.
Wonderful. Once again, for future students, if you have any questions, we would love to hear those in the chat. Raise your hand, scream them out. So Frank, I want to switch gears slightly and ask you sort of a very open-ended question, which is, what advice would you give to David, Elizabeth, Mary, Ben, and others on the call tonight about the program?
I would say do it. It was kind of an easy sell for me, but I really just think, just when you think about where healthcare has been and where we're going, just safety and healthcare quality continues to be a strong emphasis, whether it be acute, ambulatory, or even on the physician group space, of which I've worked in all those care settings. Safety has always been a strategic or an important initiative. And I feel that having the background from this particular program will really help you not only grow into that space, but help you navigate those challenges now and into the future. It's certainly been helpful for me currently in my job to be able to go back to some of the things that I've learned and apply them in my current job. But also as a non-clinician, just having that Hopkins name that just adds to that credibility for my clinical folks, which has really benefited me in my teaching of the clinical population for patient safety.
Wow, thanks, Frank. I really appreciate that. Melissa, same question to you. What overall advice would you have for future students in this program?
I would say ditto, Frank, just to do the program. It was huge that there was asynchronous learning for me, and that the program was online, because I did look at other programs that involved basically travel on a frequent basis for different parts of their curriculum and projects. And then also, I think that for me, this is, again, the next kind of evolution in the way I practice medicine, coming from kind of a traditional biomedical, upbringing in medical school. Thinking about patient safety and healthcare quality is something that I wasn't taught. And so I'm able to apply what I've learned in teaching my students and residents, because we're all swimming in patient safety and healthcare quality. Like, I can point out to my students, it's like, oh, you're saying this is line day number 7, or because you want to prevent eclampsia. So I can do those kind of bedside teaching fairly easily. And I think it's just kind of the next dimension in medicine, but then also and respiratory therapy and nursing as well. And then all avenues of medicine. And I really, really like that when a project comes together, there's best practices in terms of, guidelines and resources and frameworks for implementation, but it's really up to the people in that unit or hospital to come up with how to implement it the best. And that is a huge asset that I've learned through this program, and how to do that in my hospital or, my community, or my state.
Wonderful. Yeah, no, I love the sort of the train the trainer sort of concept, right? We're training you, Melissa, so that you can go out and share all the wonderful learning and knowledge with others. So that's terrific. I know we're coming close to the end of time, but I want to give Emily also one opportunity to offer any sort of overarching advice to folks. And then then I think we'll stay on for a few extra minutes, at least myself and maybe Morgan as well, and we can answer any other questions that folks have.
Overarching advice is just to do it. There's no downsides. I'm so glad that I did. And it's been really life-changing for me. I have a entirely new career out of this program. And I'm doing the work that I learn about every day and love it. So no downsides.
Wonderful. Thanks for all that. Well, I just want to thank our esteemed panelists for joining us tonight. Melissa, Frank, Emily, thank you, thank you, thank you. From my perspective, from the program's perspective, we are very fortunate to have all of you as part of the Hopkins family. And so thank you for sharing your time and your experiences with everyone tonight. Frank was very kind to let folks know that he's available on LinkedIn. If folks have any sort of follow-ups that they'd like to get answered, Frank has made himself available to do that. And so Frank Khan, Khan, is available in that way as well. I do want to be mindful of time. I know both Emily and Melissa have a deadline of this evening for a paper, so I want to be respectful of letting them go. But I'm willing to stay on. I think there was a question about tuition. I don't know if Morgan, you're
Morgan, you're our gal. Come on.
Yeah, I'm definitely the go-to for tuition. I just sent that link out very quickly, Sam, just so you have it before our meeting wraps up in case you have anything pressing, and I can always connect with you after the meeting. But the current cost for the program per credit is about $813 per credit. And that is also reflecting the Opal scholarship that all of our Opal students automatically receive once they start the program. The Opal scholarship covers about 38% of the program. So it's a major savings. So we can definitely go over that a little bit further, and I can send you a link with some additional resources as well, so you can kind of search different scholarship opportunities that we have here at Hopkins.
And Morgan, thanks. Am I correct? And maybe Albert, you know the answer to this one. I think the program is it a 48.5 credit program? 48.5, because you actually take one class that's a half a credit. Is that correct?
I think that's about right. It's
Okay.
It'll round to either 48 or 49 anyway, depending if you round up or down.
Okay.
And because there is an automatic scholarship that you do not need to apply for, it is the total cost of the program winds up being pretty substantially less than some of our other master's programs, like our Master's of Public Health, for instance. It's I mean, I think it's already a bargain at any price, but it actually is sort of in terms of total dollars, a relative bargain. You also pay as you go, so when you take a course, you pay for it, as opposed to paying it all up front.
And we have had students who've needed to pause the program, right? They've had a family event come up. And so they're able to take a term off and sort of rearrange the schedule moving forward. So I think it offers flexibility. So if you want to jump in and then discover that life changed somehow, you can sort of accommodate around that. Like I said, I do want to give Melissa and Emily the chance to drop off, and Frank. We really appreciate your time. You're welcome to stay on. I just want to be mindful of your competing demands. Melissa was very kind to offer her email in the chat. So for those of you who want to reach out to Melissa, her email's there. If you want to reach out to the Opal office, I'm happy to connect both Frank, Emily, and Melissa with Morgan. And I think we'd be happy to connect you all if you have sort of follow-up questions and concerns.
Yeah, and by comparison, the total cost for the MPH is over $60,000.
All right, so thanks everyone. Like I said, I'm willing to stay on if there's follow-up questions. I know Omar, you were just able to join, so if you have additional questions about the program, we're happy to answer those. It is a fully online program. And so it can be very flexible for wherever you're at in literally the world. We've had students from Australia, New Zealand, China, Saudi
Japan.
Arabia,
Barbados,
Canada, Mexico. I think we're sort of at least have covered every continent at this point, and likely have had multiple people from many continents. So it's a very international and diverse group, which makes it really a lot of fun.
Thanks, by the way, to Matt for hosting today, making my life a little bit easier, and of course Morgan for being the voice of truth when real facts were needed, and Paula, of course, for being on and helping to run the program. But real thanks to Frank and Melissa and Emily for sacrificing their very important, valuable time, especially more valuable, perhaps, in these few hours than some other days. So you've given us a lot. Thank you all. And thank you all for joining.
Yeah, thanks so much. We hope you're able to join us here at Hopkins in the Masters of Applied Science for Patient Safety and Healthcare Quality. And good night, good morning, and good afternoon to everyone. Thanks so much.